Hi, it's Batsheva from Maze Health, and I am going live tonight with Bailey, who was a patient of ours who did the Botox treatment a few years ago. She's one of my favorite patients, and she's coming on live with us tonight. So I thought it would be just great for people to actually have an opportunity to talk to somebody or actually listen to somebody who did the treatment. So I'm just waiting for her to come on. Bailey, I'm seeing you, but I don't see your name popping by here. So let's see what's going on. Oh, here we go. Great. Hold on. We're going to invite somebody. There we go. Okay. Hopefully this is going to work. I'm like, you guys, you know me already. Like, it's always a miracle to me when, okay, so connect. It's Bailey. Hi, Bailey.
Hi.
Bailey with the great red hair. Yes. I missed the red hair, Bailey. Bailey moved away. She moved to Oklahoma.
I did.
So we are so excited. Bailey, I cannot tell you the number of people who have been saying, like, oh my God, I cannot wait to see this live. I think there's women here who are thinking about having Botox, but I also think there's people here who are thinking that, you know, their sister or their daughter or their friend want to do the Botox. So I think they have, or they just are interested. I think there's some OBGYNs that are going to be joining us. So I think this is going to be an awesome conversation. So first of all, thank you so much for being here with us.
I'm really glad to be here. I'm excited that people are so interested.
Yeah, like it's great. Okay, so let's just start from the beginning. I remember, it's so funny how certain patients stay with you. I remember the day you walked into our Manhattan office, and I can tell you why I remember it, but mostly I want you to tell us what you were thinking and what had been going on with you at that point.
Sure. Well, so I had been dealing with vaginismus for a long time. I started dating when I was like 15. Was never able to have sex. When I was younger, I just thought I wasn't ready.
Wait,
and
I need to interrupt you, and this is gonna like echo back. You were having a lot of sex. You were just not having intercourse.
Yeah. Yes,
and
that's
that
an important thing. Yes.
And that was really important, and that was really amazing about you. So, like I remember that so clearly. So, you know, everybody thumbs up, like, yes. Okay, go ahead.
Yes, no, that's a great point. Yeah, I mean, I had been sexually active since I was a teenager, but never able to have intercourse, you know, which was a problem in a lot of relationships. And I didn't even figure out that I had vaginismus until my junior year of college. I went to my college's health clinic, I needed to get a pap smear to get my birth control removed, to get the prescription refilled. The pap smear was a disaster. You know, a lot of people with vaginismus have had that experience.
Oh yeah.
Both, oh, yeah. I mean, your classic vaginismus symptoms of legs locked, practically crawling off the table, and also a sort of negative interaction just with the nurse who was attempting to administer the procedure. I just felt very, you know, there was a lot of shame, there was a lot of embarrassment. So after that procedure, I went back to my college dorm room and I started finally sort of investigating why I wasn't able to be penetrated, why exams were so anxiety inducing. And I discovered vaginismus, and I found the forums that are still up today.
And I want to tell you something, and I think for people watching, this is going to be incredibly hopeful, because Bailey is talking about the fact that she felt so embarrassed and so shamed by this provider. And look at her, she's on Instagram now talking about it. Like, that can be you. I just want you to know that. So, like, people should look at you and be like so inspired. Okay, good. So you knew you had vaginismus. You self-diagnosed with vaginismus, right? Because your provider didn't tell you that, right?
Oh no, which in retrospect is one of the things that is disappointing about a lot of people's stories who later find out they have vaginismus. You know, you'll often go to a doctor or even a gynecologist who will not really help you connect to that diagnosis, will not even sort of treat your level of anxiety and pain as something to be worried about. You know, you hear a lot of the just relax, you know, nobody likes getting yeah, exactly. Both about sex and about it, you know, medical procedures and stuff like that. So yeah, I was about 21 when I first figured out I had vaginismus. And at the time when I was in college, I got this book When Sex Seems Impossible by Dr. Pachick, who helped pioneer the Botox procedure that I ended up getting. And at the time when I was in college, I started the book. I was only able to get a couple of chapters in. I mean, even the thought of reading more about it really gave me a lot of anxiety. I just didn't feel ready. There was so many years of emotion built up around it. There was a lot of shame. There was a lot of embarrassment. There was a lot of guilt in my relationships. So it took me several years.
I'm going to interrupt you for 1 second just because I need to tell you some comments that have come up. So a couple of people said, first of all, somebody said, thank you for saying you thought you just weren't ready, because that was exactly her experience. And that was like, because our brain kind of tells us, like, our body does something and then our brain tries to justify it in a certain way. That's a lot of people have said, thank you so much for coming forward, that you're unbelievably brave. I just want you to know that I'm getting all these comments and they're going to get deleted from when it goes, when it goes on this, whatever, when it goes permanently on my Instagram site, it gets deleted. But I want you to know, send hearts, guys, because this is like, and people are saying, oh my God, thank you so much. You're so brave. Anyway, I really wanted to interrupt you to say that. Okay. So now you're reading the book, getting nauseous, just reading the book, going on the forum. Yeah. Oh, look at all those hearts coming up, Bailey. Okay, good. All right.
Oh, that's nice. So I was 21. I sort of did a little bit of research and learned that there were different ways of treating vaginismus, but I just didn't feel really ready. And it seemed like such a big thing and I didn't quite know what to do. So I sort of tabled it for a while, and then fast forward a few years later, after college, I moved to New York City for work, had been living there a little while, still had vaginismus, sort of was one of those things where I said, someday I will deal with this. I want to get treatment, but it's just not time yet. And then I was 24 and I met a new partner online, and we dated for a few months. And I told him very soon after meeting him that I wasn't able to have sex, that I had this thing called vaginismus, and he was very understanding at the time. But a few months into the relationship, the conversation circled back, and he let me know that that intercourse was something that was really important to him, and that he didn't see us staying together long term if I didn't at least try to investigate getting some help for my problem. And at the time, that was a really hard thing to hear. I think a lot of people with vaginismus have this deep fear that that they'll lose someone they love because of it. It's like the deep fear of that all this shame and guilt is wrapped around. You don't want to lose someone that's important to you. So it was really a hard thing to hear initially. But I really dwelled on it for a little bit and even considered breaking up with this partner. But then I talked to a friend of mine who I had known for several years and was sort of like, I don't know what to do. Maybe he doesn't really care about me because he feels this way. And my friend was like, well, this is something you've always wanted to do. And maybe this can just be an impetus, and it doesn't mean you have to stay with this person, but maybe this is a good time to investigate. So I said, yeah, okay, I'll look into it.
And I'm going to interrupt again. I don't know if you're still in touch with that friend, but you should give her a big hug and a kiss, because I think what happens is that people who have vaginismus are very avoidant. Like, it's scary. It is so freaking scary. And so both the boyfriend, who you're not with now, but both that boyfriend and that friend, like, they were trying to get you to get help for something that you need help with. And, sometimes we'll see people who are married. Somebody went through, oh my God, that's my situation right now. But we see people who've been married for years, and it just creates so many cracks in the marriage. And what happens is the partners are enablers. Like, they think they're taking care of the person. They think they're being supportive, but they're not really helping the person get help. So I think in the end, that was super, super helpful. Okay, go on with your story. Sorry to interrupt you.
No, you're totally right. And that friend's actually watching right now. So.
Oh, good. Oh, friends, whoever you are, you're the best. I'm going to send you chocolate.
Yes. So I'm so grateful for that. And I am really grateful, actually. And I think that's an important thing to note, is it's really hard to talk about vaginismus when you're in the midst of it. And I feel very lucky that I did share it with a few people. It's really hard to open up about. And I tended to reveal it more if someone else I knew mentioned like that they had had issues having sex, that sex had been scary or painful for them. But I mean, to anyone who is wrestling with it, one thing I would definitely say is like try to share that with someone else, just because even if the person doesn't have vaginismus or has not dealt with it, it makes you feel less alone. Um, and that's
And
a big,
Bailey is on the forum, all the Mays Women's Health Forum, which is that is what Bailey is on there as recessive gene queen constantly. She's giving people, she's a cheerleader, she's giving advice, she's amazing. So anyway, that's a perfect example. Okay, so then you came to us, or what happened? You whatever. Yes, go on.
well, yeah. So then my first step was, well, and I remembered you guys because the clinic is talked about in this book. So my first step was just to see if you guys were still doing what you were doing. I looked it up. You were right there in New York City, which felt very well fated. And then I called for a free 10-minute consultation, which was in and of itself a really amazing experience because that was the first time I ever had felt like I was received with compassion by the medical field for my situation. You know, past experiences with gynecologists and with my college's health clinic, I just felt not listened to or understood at all. So even the initial conversation where the clinic understood what I was going through, they were familiar with the situation and the kind of pain and anxiety and all those things around it. It was a really amazing experience and sort of gave me the another push I needed to go through with it because I was like, wow, I've never felt received in this way.
Yeah. Yeah, and then we're going to talk about how hard that, I don't know how hard it was for the first appointment, but I just want you to know that what I remember about our first appointment, and I made sort of jokes about this, that it's been very humbling over the years for me to be able to predict, because usually you sit with a therapist first and then you see the medical person. And once upon a time, I thought I could predict who would have an easy time dilating and who would not. And I met Bailey, and I thought Bailey was a shoo-in. She was comfortable with sex. She'd been sexually active for a long time. She was going to be fine. But I had gotten humbled enough at that point to not know. So talk to us about that first appointment.
Oh, yeah. I mean, even making the 10-minute phone call, it was a great experience. But I was also just like shaking all over when I made that call. You know, and the first step in seeking treatment is often the hardest because you have to decide that you're ready to undertake the process, which you know is going to be hard. But yeah, I made that call and I made my first appointment and I was so scared when I went to the clinic. But if I recall, I met with you first, that very first time. And we had a much longer conversation about my sexual history and my issues. And, you know, from there you discussed options with me. We talked about, you know, working with dilators. We talked about the Botox treatment. And then we did some tests sort of to see whether I'd be able to dilate. And it became pretty quickly clear that dilation was not going to work. My vaginismus was very severe. I couldn't insert anything. The anxiety and the pain were so tightly connected that it was just, traditional dilation did not feel like an option at all. So we talked about it.
And I want to say, because a couple of people wrote in saying, did you try dilating first? So Bailey, we attempted with Bailey to dilate, but it became really clear that she couldn't. And that's fine. Like, I just need to say, like, that is fine. I would say that about half our Botox patients have tried dilating and either can't get past the very small size or cannot get anything at all. Like, it's so freaking scary to them. And that's totally, totally fine. So, okay. So now go on. So then we started talking about, but you were kind of new about the Botox because you read Peter Pasik's book, right?
Mm-hmm.
Yeah.
Yeah. I had known about it a while, but only when I actually went to the clinic did I really read more about how it worked and sort of learned the full extent of what it could do. And it was a scary thing to decide, you know, and failing initially at being able to dilate was emotionally hard too, but you guys were super encouraging and were like, the Botox option exists for a reason. This is something that helps a lot of people. So I felt you guys made it feel very natural to take that option and to explore that.
And it is that option. I have to be honest, like once upon a time, how many years ago was this, Bailey?
This was in 2016, so it's coming up on 4 years ago.
4 years. Okay, so when we started doing Botox, which was probably about 8 or 9 years ago, you know, we really did kind of reserve it for the really difficult patients. Like after we tried, And then at some point, maybe, I don't know, I have no idea. We were like, this is ridiculous. It makes it so much easier for people. It's a little bit expensive. So once if somebody can afford it, then that's the issue. We actually moved it. I think when you did it, we were still doing it at like a surgery center. Now we do it in our office. We have the anesthesia house in our office. So our bar for doing it has dropped dramatically. Why put somebody through the anxiety of it? That's all. Okay. So you decided to do the Botox.
Yes. So, and at the time you guys were doing it once a month, so I made an appointment. I agreed to do it in September, which was right after my 25th birthday. So was really nervous, but got ready. Took the train to White Plains with my partner at the time, and then showed up in the morning for the procedure. Showed up a couple hours early. And does everyone sort of know the preliminaries of the procedure?
In terms of like what they do when you're there? No, you should talk about what that's like. That's
great, yeah. So just to sort of go over what I knew going in. So Botox, as a lot of people know, it's often used cosmetically to stop muscle spasming in the face, to keep you looking younger. But since vaginismus involves the clenching of your vaginal muscles, injecting them with Botox enables them to stop that spasm that keeps you so tight and unable to be penetrated. So that's part of what the Maze Clinic does. But the part that really helps lock in the success is you get the injection, but also that's done when you're under anesthesia, and the operating doctor inserts increasingly large dilators while you're unconscious. And then you wake up with a very large dilator inside of you. And that's a really important moment of the process, because a lot of people, including me, you sort of come to believe that there's something wrong with your vagina, that it could never be penetrated, that there's something physiologically wrong. But when you wake up and there's a dilator inside you, a large one, it is this way of helping your brain accept that it is possible to be penetrated without pain, which is a really helpful thing to draw on that knowledge when you begin a dilation routine and know that not only that it's theoretically possible, but that you have done it before, that it has actually happened. So anyway, I can't...
Yeah, I think it's the most common question that women ask when they first wake up from dilation. When they first wake up from procedure is like, is it all normal? Is everything okay down there? Like really and truly on some level, women feel like they don't have a hole down there. And I get it. I'm getting a lot of hearts here. Because I have a little heart to Bailey, because just listening to this is like, but it's so hopeful. And also you're still very calm from the anesthesia. So you kind of wake up and you're like, oh my God, there's actually something in there. It's not hurting me, because we also insert lidocaine. So yeah, okay, go on. So that, okay. Yeah.
So I showed up knowing that.
You're getting flooded with hearts, Bailey. Okay.
Oh, wow, that's so nice. Yeah, so I showed up expecting that to happen. You're not allowed to eat 12 hours before because there's anesthesia involved. So you show up, you do your inpatient procedure, you sit in a chair with a warm blanket on you, or that was a part of it. And by then I was very relaxed. And then they put you under, and, you wake up, 15, 20 minutes later, not even that long at all.
It's short. It's really short. Mm-hmm.
And there's a huge, I actually have my dilators here. So this is what a set of dilators looks like if you haven't seen them before. There's a lot of different brands. And I woke up with this one inside of me, which is like, it's very large.
You're going to scare people, Bailey. I once had a patient almost pass out and we pulled out the large one by accident. If that freaks you out, just rewind. Okay, go on. Yeah, no, yeah. But it's crazy. Yeah, it's crazy. No, if somebody had told you that beforehand, would you have believed it?
No, I mean, someone did tell me, but I knew that was how it was going to work, but part of you kind of doesn't believe it. The only way you can go through with it is knowing, like, I will be totally not conscious. I don't have to do anything. I just wake up and it happens. But yeah, and that's what happened. I woke up, the dilator was inside of me. It's a really emotional experience because, like I said, you spend so much time thinking like, there's something wrong, this will never work, and then it does, and it's really a stunning thing to have happen, for sure.
So then, like, I just like, the story doesn't end there.
So Well, so both for the procedure and the outpatient stuff. Yeah. So the rest of that day, you wake up, they do some stuff at the place where you get it done. And then for the rest of the day, I had to go to a hotel, and I had to dilate with a smaller dilator and just leave it in all day. It's this size. And so I did that all day. I slept with the dilator in. I woke up the next day, and I went back to your office that's up there. And you were there, and we talked about how it went, and you talked to me with and without my partner. I worked with Melissa. She helped me practice putting in and taking out the dilators to make sure that I knew how to dilate. And then you sent me on my way for that part of it. But then the thing that's important about Botox is the Botox itself lasts, 3 to 5 months or so, the actual effects. So it's important during that time to be dilating so that you can actually, so that you can get used to having things inside of you for when the Botox wears off.
Right. I mean, a couple of people ask you have to re-inject. If it's done right and you keep dilating, no. It's giving you this window, this 3 to 6 month window where the muscles can't clench, so you can just keep working with them, with those dilators, so you're not so scared, there's no pain. Think about learning how to do a split. Like if you were learning how to do a split, like you just, every day you're getting those muscles just more comfortable. So how long did it take you to get through the dilators? How long till you had intercourse? I know that was a question that kept coming up.
Yes. Okay. So, well, just to go back to the set of dilators, if you are someone who dilates, who only tries dilation, you usually start with one really small, something like this size. Since I had done the Botox, I was able to just start with this size. I dilated every day, which I think is a pretty important part for really, locking in your success. Like like you said, getting your muscles used to everything.
And was it painful? Was that painful? Do you remember it being painful?
So this is an important distinction, and we see this question on the forums a ton. People asking, "I'm feeling a burning sensation. Is something wrong?" It's not painful in the way that, like, when something would try to penetrate me before the Botox, there's a very distinctive, sharp pain. It's not painful in that way anymore, but your muscles are stretching. It's like you said, or like if you've ever learned a new sport, you've ever taken up running or something, and you have that muscle soreness as you're first starting something new.
That's a great analogy. I love that analogy, Billy. Yeah, go ahead.
You have a burning sensation in your vagina, which is an important part of the process. It actually means it's working because your muscles are getting used to stretching for the first time, because they've been so tight for so long. So I dilated every day. And normally when you dilate, first you'll get really comfortable with one size. And then as you get more comfortable, you'll start with that size, and then you'll move to the next size in the same session to sort of get used to larger and larger objects. And so I did that every day. And I also did it some with my partner at the time, would have him insert the dilators. Sometimes he would stimulate me while I was trying to dilate, because it makes you more relaxed when you're aroused, which helped a lot. And I was emotionally prepared for it to take a while just because I had had vaginismus for like 9 years of my life. But 20 days after I got the procedure was the first time I had intercourse. So that was pretty crazy.
That was amazing. 3 weeks. And did it hurt at all the first time you had intercourse?
No, it was. Now I had dilated before, and when you dilate, it's not. There's not pain, but it is sometimes uncomfortable, especially when you have never had anything inside you before. It's a weird feeling to get used to, like the fullness of having something inside your vagina. So it was strange, but no, I did not have pain. It was a very emotional experience. The first time my partner put his penis inside of me, definitely cried. It was such a long time coming. So it was a huge moment. And at first when we started having intercourse, it wasn't painful, but it wasn't like arousing really, just because, you're still getting used to it. And I would say about a month after we were first able to insert his penis was when sex started actually feeling good, intercourse. which is also a really fast turnaround, all told, especially after having had vaginismus for like 9 years.
Right. I mean, on the one hand, I always say to people, like, it's crazy that people don't get help for vaginismus because it's so treatable and it's so quickly treatable. On the other hand, I do want people to know that Bailey, because you were so comfortable with your body and you were so comfortable with sex, your trajectory was a little faster than I think average. But we definitely have other people that did that. I mean, we had somebody who a week after they did the Botox went home and maybe 2 days even, like really went back. And but that's not typical. What's more typical is that it takes usually a month or two until you feel like you're ready for intercourse. But it was amazing. And so, and then, right. And then now people also ask, do you keep dilating?
Yes. Okay. So the first couple of months after I had the procedure, I dilated. And once I was able to have intercourse, I had been doing it every day. I pulled it back to a few times a week. And then I would say by like 3 months after first intercourse, I wasn't really dilating at all. And I haven't dilated in years now. So once I was able to really get comfortable with intercourse, like when I pulled out the dilators for this conversation, I hadn't touched them in a really long time, which is really amazing. Like to think that you can actually completely leave vaginismus behind you and be totally cured.
I think I need people to hear that again. You can actually really leave vaginismus behind you. But we do tell people that even once you're having intercourse, you really want to have something in your vagina for like 3 times a week. That's what we say, either a dilator or a penis or a dildo.
Yes.
And for some people, the trajectory is a little different. And often when people have babies, they have to go back to dilating. But that's true about women who don't have vaginismus too. So,
totally.
So yeah. So do you ever think about it anymore, or you feel like it is so behind you?
I think about it because I'm on the forums and am constantly hearing other people's stories, so it sort of keeps it alive in my mind. But the thing that is, again, it's so crazy. Like I have since broken up with the partner I was with when I had the procedure, and I've had new partners. And those partners, if I didn't tell them I'd have vaginismus, would never know. Like, which is really a crazy thing to think about, because when you're in the middle of it, you feel so trapped, and like, I will always feel this shame, I will always feel this guilt, and that part of it is very much a part of the past,
How about gynecological exams and tampons?
Tampons are I think this is something that's interesting. I'm able to put in tampons. I've never loved them, and I was so late to the game to using them. I have to lay down to put in a tampon. Which is honestly something I'm still working on. So, it's honestly still a journey. And it's like you said, I mean, even people without vaginismus have really different bodies, and sex is very different for them. Like, for example, I always have to use lube when I have sex, with intercourse. Some people don't, everybody's really different. But I'm able to use tampons. I can get exams, and I'm able to have pain-free intercourse, which is really huge.
Right, absolutely. Somebody asked here why you couldn't keep the largest dilator in right after the procedure, and I'll just say it's asking your muscles to do a lot. Like, you can do it. Like, we want you to wake up and know that you can do it, but it's really asking your muscles to do a lot of stretching in a very short period of time, so that burning would be worse. So that's why we say go down to look at the difference. Like, usually you start with this teeny tiny one, and Bailey's saying, well, you go the next couple of days, you use the small one. That small one she's pointing to ain't so small. So I'm sure there are women watching and thinking not so small. So yeah, I think people also want to know what people around the people with Botox can do to help them, like their partners or their friends or their sisters or their brothers. Yeah. Would you have any thoughts on that?
Yes. So I'll address people who aren't partners first, and then partners, because it's a little bit different. For friends, I think what is really helpful is just listening without judgment, because there's already so much judgment that's coming from the inside about shame and about guilt. And like in college, it's an age where people are like really starting to have a lot of intercourse, to talk about it a lot, and that would be sort of hard, like when, say, around the brunch table in the dining hall, everybody was sort of talking about their exploits that weekend, and in your mind, you're sort of like, oh my God, I can't tell people I feel this way. I'm so embarrassed that I'm not out there doing this. but to have friends and family members and whoever, you know, hold space for you and like listen to how that feels, and during dilating to check in on how that's going, you know, and to be encouraging. Because another thing that I think it's important to know about dilating is like you will occasionally have setbacks that can be super discouraging, especially if you feel like you're getting close. Like some days you might be able to get a size in, and then the next day that size is really hard for some reason, which is super normal. You know, our bodies change a lot, especially, I mean, women, we have a menstrual cycle that changes a lot, sort of our comfort level, what's happening. Um, so knowing that the you know that even as you make progress, you might slide back a little bit, but that's totally normal. And just to keep going, you know, is big. And people who continue to support, that's super helpful.
Love that you're saying that. I wouldn't have thought to say that, and that's the advantage of having a patient. Yes, I mean your body's just change, like the same way that if you're running a marathon and you're training, some days you are in the zone and you run really well, and some days you don't, and that's so normal. And but vaginismus patients tend to be so hard on themselves, like so
Yeah.
hard on themselves. So yeah,
Right. And especially I think, and it's true, like any aspect of your life, you know, there's good, you know, there's an ebb and a flow to it. And I think something about when you feel yourself getting closer, any kind of step back can feel really emotionally agonizing, but it's a super normal part of the journey. We see that question a ton in the forums, though. People saying like, "Oh, I got 2 in, and then I got 3 in, but then I had to go back to 2," and you know, all of that is so normal. And like, I think it's also really important to pull back and sort of say, you know, maybe you're having a bad day, but think about what you couldn't do 2 weeks ago that you can do now. And that, you know, I think that's a place to pull some inspiration from, because the progress can be really fast. And even when it's slower, it's like, you know, you're making progress on something you've probably dealt with for years, and you're actually moving forward. So that's really important to keep in mind.
that is so unbelievably helpful. I mean, I think also I just want to give you the statistic. 1 in 10 women have some version of vaginismus. 1 in 10. So when you're sitting around that brunch table at college and everybody else is talking about their great sex life and some people are a little quieter, you know, there's other people at that table. If there's 20 women around that table, 2 out of them have the problem. So, you know, I feel like it's finally getting talked about a little bit more, which is amazing. But somebody did ask, and this is a little off, whether you can do this when you're pregnant. And I would say we wouldn't do it if you were pregnant. And then somebody's going to say, well, how did you get pregnant? But people do artificial insemination, whatever. There's a lot of, but we actually had a patient who's married 25 years, 27 years. She had 3 kids by artificial insemination. And she finally decided for her, like, I don't know, 52nd birthday, she was going to do this. And 8 weeks later, she was fine. It was crazy. I'm like, anyhow, so, yeah, somebody just said, I had no idea it was 1 in 10. Yes, it is 1 in 10. It's somewhere between 7 and 15%. So I like to say that's 1 in 10. This was so unbelievably helpful. Bailey, is there anything else that you feel like you would want to say to people? And we can have you back if you're willing to come back, because I'm sure people are going to have some.
Never, honestly. The thing that I wish I had known, or the thing that I would tell people to consider is like, I spent a lot of time waiting to be ready. And I think like, you absolutely do need to be ready. But, and at the end of the day, the reason I ended up calling you guys was that I chose to be ready. Like, I decided and you can do this for so many reasons. You can say, I don't want to feel ashamed anymore. You can say, I want to have intercourse with a partner to connect with them. But you probably won't wake up one day and say, oh, I'm so excited to like undertake this really long and emotional and sort of physically draining process. But I think you can wake up and say, I'm ready to not feel this way anymore. And that if you draw strength from that decision, that it can really take you to the place I am now, which is pain-free intercourse, and I don't feel that shame and that guilt and all those bad feelings anymore. So, you know, I would encourage people to think about, you know, are you like, can you make yourself ready, and can you find a way to?
So I have 2 suggestions regarding that. So one is, somebody said to me, what's the forum you keep talking about? So I'm laughing because May's Women's Health, if you go to the website, May's Women's Health, there is a big forum that is, it's a pain forum. It's 90% vaginismus. And I would highly recommend you go there. And if you're only ready to do that, if you're only ready to read people's stories, talk to people, that's fine. If you're only ready to make the 10-minute free, you know, you just make a free phone consultation, You don't have to come in. You can talk to somebody. Just talking about it often removes the shame. And then you can do it a year later if you want to. Somebody just wrote, I've been so scared to make the phone call, but I feel better about it now. I truly appreciate your sharing a story. So I think that that's really true. Somebody
Yeah.
did say, wait, how can partners be helpful? And I would argue partners should be conscious of like not saying whatever you do, honey, I don't care, unless they really don't care. But this being able to put something in your vagina is an important part of being an adult woman. You need to have gynecological exams. You need to be able to have intercourse. You need to be able to work that part of your body. So saying to somebody, look, I love you. I'm here for you, but let's get you help is really a good way to go. And then really being there while you're doing it. Do you want to say anything else about partners?
Oh, yes, yes, that's a really excellent point. And it's funny because I had a range of partners before I stopped treatment, and they had really different reactions. And I had partners who were like, you know what, I don't care, I love you. But then this partner I was with when I ended up getting the treatment, the reason that it ended up coming up that he wanted me to seek treatment, it was actually in the context of like, I mentioned that I hadn't had a pap smear in a long time. I got one several years back under anesthesia, actually, because I wasn't able to get one normally. And I really respect that he, and a thing that I think is interesting is a lot of women have a fear that someone, like I said, you have a fear that someone will leave you eventually because you can't have intercourse with them. And I really respected that my partner was really honest in his desires and in his concern, because instead of like waiting until he was so miserable and sexless that he just dumped me, he gave me the option of actually helping to solve the problem, which was a really big gift, you know, to actually let me explore that instead of just, you know, keeping it to himself because he didn't want to hurt my feelings. So anyway, all of that is to say that I think as a partner, you can respect your partner's need to be ready to start that journey, but also like make your own, honestly, your needs clear. Like if you feel that you will not survive in the relationship without intercourse, I think that partners should share that. You know, it shouldn't be a thing that is undiscussed and that leads to the decay of the relationship. So, you know.
And he was kind of with you every step of the way, right? Like he came to the appointment, he came to the procedure because you need to have somebody with you. He helped you dilate. Like he was really super supportive. And I don't think I ever met him actually, but yeah. Did I? Anyway,
he was.
Maybe I did.
I think he did maybe one time. No, he was super supportive, and honestly, it helped so much to have someone to go through that with. And you can seek treatment absolutely without a partner, but partners out there, I mean, you can be such a rock. You can be encouraging. You can sort of boost morale. You can help dilate. You can help stimulate your partner while they dilate. You can just be there for them and listen to them express sort of how they feel about it. But I think
and you cannot rush them.
Yes, that's a big one because, I mean, everyone's journey takes how long it takes. You know, some people are fast, some people are slower. What really matters is say that they're trying every day, even if the progress is slow.
Right. So I think to sum that up, as a partner, you want to be honest and you want to be helpful in terms of helping them get help. Like being supportive does not mean sitting around for 10 years while they don't do anything. On the other hand, once they start getting help, you want to be encouraging and supportive and not be like, when can we have intercourse? When can we have intercourse? Like that's not helpful, right?
Yeah.
So, yeah. And the truth is we have a lot of patients come in without partners. And sometimes that just takes the pressure off. You know, their mom brings them, their sister brings them, their best friend brings them, and they work with the dilators and they have no pressure and they do it very gently and slowly. And then sometimes we transition to dildos because they want to really actually feel what it'll feel like to have a penis in there. So that's perfectly fine as well. So I can't even begin to tell you. So many people have been coming through. The hearts are coming through. People are just so appreciative. And honestly, Bailey, I am so appreciative because I feel like, you know, you're changing the world with your willingness to get on and talk about this. Like, I feel like I wish everybody was willing to talk about it because it seems like such not a big deal. Like you have an earache, you have a headache, you have vaginismus, but not everybody is willing to talk about it. So, so is there anything else or should we say goodnight?
I think, you know, that's the basics, but yeah, I'm always happy to come back, and I encourage people, you know, to even if it's a secret you hold inside of you, share it with someone so that you feel less alone in that, because there are so many women who feel the way that you feel, and so many people who have gone through this journey, and you're not alone. And don't let yourself feel alone, because that makes it a lot worse. And I think that I know that there are solutions and that there are treatments. So your now is not your forever when it comes to vaginismus.
Okay, I love that you're willing to come on. If you guys want to continue your conversation with Bailey, she's on the forum. So that's where you find her.
Please come to the forum. We love to hear your stories.
What'd you say?
We love to hear your stories, but I talked over the URL, so say it again.
That's fine. MaysWomen'sHealth.com. Just look for the forum. Post your questions. Bailey's on there a lot. We really appreciate it. And Bailey, I just can't thank you enough. And hopefully we'll have you back. In a few months, maybe people have more questions. And this will be saved. A few people have asked. This will be saved on the HDTV section. And, so if you have a friend, a best friend or a sister or somebody needs to see it and they need to talk to Bailey or watch Bailey, that's the way to do it. So I know it's an hour earlier in Oklahoma than it is in New York, but I'm sending you hearts with all the hearts that are going up. And have a good night, Bailey. And thank you so much.
You too. Thanks so much, everybody.
Bye.
Bye.